So I'm Brendan Atkin. I'm an osteopath, and so I'm a human osteopath first. So you need to be a human osteopath before you branch into the animal side of things. So that's a 5-year course. I was trained here, and then I started work here in about 2008, 2009 with Anne at the clinic. And then I went overseas and did some further training, another 2-year masters into to specialise into animal osteopathy. So a normal treatment is about half an hour. So there's an initial history taking, like you see like you see a vet or like you see any other medical practitioner, just to get a thorough history of what's happened to the dog so far, and then potentially how I'd be able to help. So I'm asking about what they've brought them in for, and there's a multitude of things that people come and see me for. So what I've noticed as Lockie's moving is he's a little bit sore through this side today, through this left forelimb. So what I want to try to do is I want to help him with that process. This is a bit sore. It looks like it's in the elbow or maybe slightly higher up in the shoulder today. If I can work on the areas that all holding onto that area and preventing it from functioning as it optimally, then he should hopefully walk out a little bit better.
Lovely.
Most of the time it will be mobility issues and puppy checks and show dogs, and there are lots of different types of scenarios that kind of present to me here. And then I'll perform the assessment. Most of that will be done within sort of 10 minutes or thereabouts, the history and the assessment. I'll take the dog outside and I'll watch them move to make sure that what I've felt is backed up by the way that they're moving. And when I'm happy that I've got a diagnosis or a working diagnosis to go with, then I'll start with a treatment, and that's around about 15 to 20 minutes worth of hands-on. There'll be possibly at the end some home exercises to do to either build the dog up, get the strength back in terms of rehab. Sometimes I'll offer kind of stretches and show the owner how to stretch the dog and where it's going to be most effective, and that can really help in between treatments. Normally for an acute problem, it'll probably only take a couple of treatments to get the results that I'm looking for. For a more chronic, kind of long-term issue, it can take a little bit longer, but the idea is that we get the dog to the point where they're not in any discomfort anymore and they're moving okay, within the limits that they have, and then we can check on them every now and again. Lockie's a fantastic dog. I've been seeing him pretty much since I started here, I think in about 08, 09. And he is now 13 and a half, and he's suffered from some fairly early onset arthritis in both of his elbows, and that obviously affects his mobility quite a bit. So we need to be a little bit realistic in the way that we manage him, but he responds incredibly well to treatment. And the results that I've seen, he comes in really limping and dropping his head and lifting it up, try to take weight off that elbow, and by the end of the treatment he's a lot more comfortable, a lot more balanced in himself as well, and so he finds that the placement of his paws is a lot easier. He can load through the limb a little bit easier as well, and you can see he's more comfortable and a bit happier, and that keeps him going for quite a while. And then I check on him maybe every month or so at this stage. But he is 13 and a half, and he's a Labrador, and he's moving pretty well for a lab with the kind of prognosis that he had in both of his elbows. I think he's doing really remarkably well.